Operating room nurses have a great deal of responsibility. They are given roles according to their experience and skills. Three of the most basic divisions include scrub nurse, circulating nurse, and RN first assistant. To be an operating room nurse, you need the character just as much as the skills. For all the responsibilities at hand, operating room nurses are compensated very well. The starting salary is outstanding, and the job opportunities are on the rise every year. Being smart and dedicated won't cut it. To be an operating room nurse, you need a drive that starts from within. Let's head over to our professionals at PUC Live for more information on the topic.
Welcome to PUC Live. Today we are going to be taking you into the life of an operation room nurse. Before we go on our little adventure, let me tell you a few facts about the roles of the operation room nurse. To begin, I'm going to tell you about the different divisions of the operation room nurse. The first division is the scrub nurse. This particular nurse is inside the operation room with the doctor. The scrub nurse is responsible for knowing the names of the operation tools and handing them to the doctor while the doctor performs his or her operations. The scrub nurse needs to be familiar with the names of each tool in order that the operation will be performed smoothly. Another division is a circulating nurse. This type of operation room nurse is responsible for performing multiple tasks inside the operation room, and they are also responsible for keeping multiple patients comfortable and safe. The more specialized the operation room nurse is, the more responsible they become with helping the doctor. They are kind of like the backup surgeon when it comes to knowledge. The nurses do not get to perform the operations on any patients. They perform specific tasks on the doctor's request, such as controlling bleeding during surgery, aiding wound exposure, and also performing sutures.
The more specialized the operation room nurse is, the more responsible for certain tasks they become. First RN assistant is a more specialized function that OR nurses perform. A first RN assistant has to undergo specific training in the field of providing surgical care. They are kind of like a backup surgeon. Although they do not perform surgical operations, they perform specific tasks on doctor's request, such as controlling bleeding during surgery, wound exposure, and also performing suturing. OR nurses do not only have to focus on the operational side of things, they can also work in the business area, such as budgeting. Now that you know a little bit more about what an OR nurse does, let's go into more detail on what are some of the basic characteristics and many skills that OR nurses should have. Lynette is going to show you some of the basic characteristics that an OR nurse should have.
Some desirable qualities that a perioperative nurse should demonstrate are empathy and compassion, the ability to provide competent care through their nursing practices, to have the knowledge and ability to apply what they have learned into their job, to demonstrate good communication and listening skills when being one-on-one with the patient, to have flexibility when working, have a positive energy when learning new things or when working with others, to be able to learn from your mistakes, to have the ability to remain calm and at the same time remain alert when confronting stressful situations, and to finally have an interest in this specialty.
A beginner OR nurse gets paid $22 per hour. With a year of experience, OR nurses can get paid up to $40 per hour. The average is $30, which is still not bad. The yearly total salary for an OR nurse is from $46,561 to $88,598. The employee rate for an entry-level OR nurse is very high. There is a very good chance that you will get hired when you get out of school.
To qualify as an operational room nurse, several criteria must be met. First and foremost is completing college-level education. There are 3 ways to go about this. One must have completed at least an associate's degree of science in nursing, which takes approximately 2 to 3 years to complete, a bachelor's degree of science in nursing at a 4-year university-based program, or a 2 to 3 year diploma program from a hospital. After obtaining a college diploma, you must work for at least 1 year of clinical experience. When you have finished experiencing a year's worth of clinics, you will now be eligible to take the National Council Licensure Examination, or the NCLEX-RN. Once you pass this exam, you will receive licensure as a registered nurse and will be able to practice in the field. An optional but highly recommended step is to become an CNOR certified nurse. If you are willing to go the extra mile, certification gives you preference and demonstrates how competent of a perioperative nurse you are if you choose to further advance in your nursing career.
To summarize, being an operating room nurse is first, one needs to complete a college-level education, which is completing an associate's and a bachelor's degree of science in nursing, pass the National Council Licensure Examination, and lastly, becoming CNOR certified. The different divisions of the operating room nurse again is first, the scrub nurse, with the task of knowing all the tools in the OR and handing them to the doctor when it is needed. The other division is a circulating room nurse. They are responsible for keeping multiple patients comfortable and safe. To become a great operating room nurse, one needs to show empathy and compassion. One needs to have the knowledge and ability to provide proper care for their patients. And lastly, to always have a positive mentality while working and to love the specialty that you do.